Hello and welcome to the Dental Talk Show. I'm your host, Nick Peters, and today's show is a special on the Invisalign system. So what is Invisalign? Invisalign treatment consists of a series of nearly invisible removable aligners that you change every 2 weeks for the next set of aligners. Each aligner is individually manufactured for your teeth and your teeth only. As you replace each aligner, your teeth will move little by little, week by week, until they have straightened out into the final position prescribed by your dental practitioner. What's more, a virtual 3D treatment plan shows the series of movements your teeth will go through over the course of the treatment. This allows you to see up front what your teeth are expected to look like at the end of the treatment. From the results of the ClinCheck treatment plan, your custom-made clear aligners are produced especially for you. In the dental chair today is Dr. Raj Kumar, who works at Former Dental, which is in Harley Street in London. In 2004, Dr. Kumar achieved qualifications in Invisalign, and in 2005 he became a Platinum Elite Invisalign dentist. He is now recognised as one of the few nationwide clinical speakers for Invisalign and has completed over 760 Invisalign cases over the course of 9 years. Dr. Kumar has a particular interest in orthodontics. I hope you enjoy my interview, and here it is.
My name is Raj Kumar. I'm a cosmetic dental surgeon. I've got 23 years of cosmetic dentistry experience, but for the last 9 years I've been sort of specialising in Invisalign orthodontics.
All right, and you were in orthodontics before it sort of came leaps and bounds with Invisalign?
Not at all. I literally was doing veneers every week, day in, day out, smile makeovers, dental implants, etc. I found it very, very aggressive technique. It all boils down to what the patient thinks of the veneers once they're fitted.
Yeah.
And the only option that we used to have in those days were metal braces. So 9 years ago, Invisalign turned up, and I just started doing Invisalign and stopped doing makeovers.
Did you have braces yourself when you were younger?
No, I actually missed out, but I did actually treat myself with Invisalign. And I'm still treating myself, I think, because we tend to sort of go overboard treating yourself.
Right, okay. Yeah, because I used to have the old train tracks on my teeth, and, I think that's still a lot of people's perception when you talk about orthodontics.
We tend to find that people that have had train tracks are then coming back 10 years later, having not worn retainers. Teeth have moved all over the place. They're in their mid-20s and mid-30s, and they don't really want to go down the metal sort of system. So Invisalign works perfectly for those patients because they don't want to go through all that trauma again. Yeah, I mean, Invisalign can treat patients from mild to severe crowding, because sometimes what you think is severe is actually not that severe. You just got to open up the arch and move the teeth around.
Right.
It's not great at rotating a canine because that needs a lot of force. But I mean, I've done patients with 12mm overjets and severe crowding, all done with Invisalign.
And what is there an age group that's sort of?
My youngest patient is 14, and the oldest patient was 75. So teeth move at any age. I tend to wait till they're 14, 15. The younger people I tend to treat are in drama and theatre and stuff, and they want to look good.
Obviously. And what's the sort of protocol? So how many times would they have to come in?
I think the initial thing is a consultation, and it's got to be a long consultation. You've got to look at their teeth, you've got to take photographs, you've got to show the patient what they look like, and then you just sort of describe to them how orthodontics can help. And if they've seen what I've done, then they know it can be done for them. And then with Invisalign, you're sort of wearing the aligners night and day, but you're coming in every 6 to 8 weeks. It's quite flexible. You can have holidays, you can go travelling and things like that.
With implants, would you do this as a preliminary thing before you do the implants? Because sometimes I've seen cases where you're sort of sticking an implant into an arch where you could have done some orthodontic treatment beforehand.
It depends. I mean, the cases that I think about are where the teeth have drifted forward. The pontic space has been reduced. So Invisalign can be used, as with any other system, to distalize the teeth, open up the space so you've got an adequate pontic space. I tend to see mostly orthodontic patients first, who may then need an implant, and that helps in that sort of way, in conjunction with it.
There are a lot of other systems on the market. Why would you use Invisalign?
Well, I started 9 years ago with no orthodontic training, and I started using Invisalign. When I started seeing results after a year or 18 months, I was very, very happy with the system. Invisalign uses CAD/CAM scanning, and also computer aided software. So the accuracy of the movements of the aligners is so accurate. I can treat a patient for 2 years with not one dental visit in between. So why would I want to move to an inferior system to save some money? I can't see the point. I don't want to have patients having complaints and getting unhappy. So Invisalign's accurate enough from one impression to treat the whole arch. But we always do refinements at the end of the treatment for minor corrections. So that's why I've never looked at another system.
Thanks for listening to Dental Talk Show. You can follow me on Twitter @Dental Talk Show, and I hope you enjoyed the show. I'll speak to you soon. Bye.